My name is Helen Dickinson and I'm Professor of Public Service Research within the PSRG. I'm going to talk about a piece of work we did looking at vaccine hesitancy in disability support workers with colleagues at the University of Melbourne, Anne Kavanagh, Stephanie Dimmoff, Marissa Shields and Ashley McAllister. People with disability are an at-risk population in the COVID-19 pandemic because they're more likely to have underlying clinical issues and face a range of socioeconomic disadvantages. Those who require paid support to assist them may also be more likely to contract COVID as they're in contact with disability support workers and often support people across a range of different settings. In Australia, we prioritise people with disability and disability support workers for vaccination, and prior to the rollout of this vaccination, we did research to explore disability support worker understandings of the vaccine and whether they intended to be vaccinated. We undertook a survey that just over 500 disability support workers completed. We found high levels of vaccination hesitancy. 19% said that they wouldn't get the vaccine, and another 12% only if they were required to. There are a number of reasons given for this. Some didn't feel that COVID was as bad as was being made out in the media and felt that the vaccines had been rushed and might not be safe. But many said that they didn't trust the government. They felt that the disability support worker workforce had been forgotten in the COVID-19 response and were experiencing difficulties as their employment terms and conditions have been eroded in recent years. Many of these roles have been casualised with less employment security and lack of entitlement to things like sick leave. What this shows us is that how disability support workers are treated has important implications for the care that they're able to provide to people with disability. It also has important implications for who should provide public health messaging to this group, given that they mistrust the government so much. And out of this, we've developed a series of proposals for how vaccination uptake in this group might be encouraged.